So thank you all so much for joining us. Today, as Sue said, our presentation is titled Eating Disorders and Disordered Eating in Plain Sight. We are thrilled that you have chosen to attend this session and to learn more about eating disorders and how to support loved ones and people struggling in your life who are struggling with eating disorders. My name is Erin Houston. I'm the education coordinator with Body Brave. I have lived experience of an eating disorder. I was diagnosed with anorexia nervosa when I was 16 and have experience navigating the pediatric eating disorder hospital system and community support systems or community-based systems as well. And of course, you had a great introduction to my lovely co-facilitator, Dr. Karen Trollope, who has lived experience as obviously both a medical professional for people struggling with eating disorders, but also a caregiver. And so hopefully you're getting kind of a breadth of different experience from today's session. I do always, as usual, want to begin by taking a moment to connect to the land that we are on. And for those of us who are joining from somewhere that is close to Body Brave and CMHA Hamilton, acknowledging that this land is the traditional and unceded territory of many nations, including the Erie, the Neutral, the Huron-Wendat, the Haudenosaunee, and the Mississaugas. This territory is covered by the Upper Canada Treaties, which is directly adjacent to the Haldeman Treaty territory. And it's really important for us at Body Brave to acknowledge in our land acknowledgements, specifically referencing that we do work with body image issues and eating disorders, and that Indigenous peoples, First Nations, Métis, and Inuit peoples are often left out of those spaces, whether it's research or conversations around stigma and support. And it's our responsibility to work towards decolonizing those spaces and creating spaces that can be indigenized for the people who need that kind of support. Of course, it's also really important to talk about the ways that traditional food practices of Indigenous folks have been co-opted and villainized and destroyed through colonialism as well, and the effect that that can have on Indigenous folks and communities' relationship with food, and the important role that that plays when we're talking about disordered eating and eating disorders. So I just want to make sure I mention that. We have a few different objectives today. Of course, we only have an hour and I want to respect everyone's time. So for some of the concepts, it might feel like we're kind of flying through quickly. If you do want access to the slides, please feel free to email me. Christina will put my email in the chat, erin@bodybrave.ca. And of course, there is the recording that will be available on CMHA Hamilton's website. If you do want access to any of these pieces. So for today, we do want you to walk away with learning a bit about identifying disordered eating and eating disorders, potentially to help with early intervention. We know that the earlier that intervention happens, the greater chances there are of making a full recovery from eating disorders. We want to explore available supports for loved ones struggling with eating disorders. The ones we'll talk about are a little bit more specific to Ontario. But we really do encourage you to look for supports that are available for the people that you know and love who are struggling as well. And then increase understanding of disordered eating so that you can help support someone and what that looks like. We do invite you to ask questions. We probably will not be able to get to them all, but it's great for you to ask questions just so we know what we've left out of the session, what you would like to see more of, and all of those pieces. And of course, please do put those pieces in the thing, what's it called, at the end where you fill stuff out. References are included throughout the presentation, and there is a full list at the end if you're a reference person like I am. Please do what you need to do. We know there's still a pandemic going on. Many folks have competing priorities and needs. So if you need to eat or step out, of course, please do what you need to do. This is being recorded and you will have access to it later. And just a note, we are presenting from our own personal and professional contexts. And so we are trying to present as much as we can and offer as much insight, but these won't represent every single perspective or approach. And so we do encourage you to take what feels relevant and what feels like it will be helpful and leave the rest. The more critical thinking that you do in terms of what really feels like it applies to you and in your situation, hopefully the more you'll get out of our conversation today. So we already did a great introduction to Body Brave, but we are a charitable nonprofit in Hamilton, Ontario. We offer low barrier treatment and support to clients across Canada and Ontario at large. So we offer group support, individual psychotherapy, medical assessments, and self-guided virtual support as well. So we have those things available at no cost for our clients. And then we also spend a lot of time on the education side, as you see us here. And we have professional virtual trainings for physicians, nurse practitioners, dietitians, social workers, psychotherapists, all available on our e-learning platform. If you have any questions about those things, please feel free to email me. But without further ado, we will jump into these pieces. I see a few people just entered. If you can, please mute yourself just so that we can mitigate the amount of background noise, and just so that people can hear as much as they can. We're going to dive in, and I really want to kind of just kick off the conversation today with a brief introduction to eating disorders and really fleshing out what it is we're talking about, and how eating disorders and disordered eating show up in your lives, in the lives of loved ones, and what that kind of looks like. So in the chat really quickly, or just in your head, whatever feels good. When I say disordered eating, what comes to mind? Maybe it's a behavior, maybe it's a certain image. What are the things that kind of pop up for you automatically? Feel free to put them in the chat or just think them in your brain. That also works, whatever feels good. But a common one that kind of we might think about is restriction. We might think about binge eating behaviors, or eating compulsively, or emotional eating, eating for comfort. Yeah, absolutely. We'll get into that a bit. Dieting, over exercising. Absolutely. Yeah, overeating. Yeah, absolutely. So just kind of like ways of eating that aren't necessarily conducive to like a balanced relationship with food. Purging, absolutely. Yeah, okay, awesome. We'll get into all of these pieces. So just good to know where people are at, and what that looks like. So eating disorders are mental illnesses with physical manifestations. They're complex health conditions that without treatment can be deadly. And so it's really important that we kind of break down what that looks like and what that means for people. So when we think about disordered eating, we think about behaviors, the behaviors that someone is exhibiting. What is the actual disordered eating habits or tools that someone is using? And the other side that we think about is eating disorders. And so these are kind of the diagnoses that you might know or might have heard of. And so these are disorders that can affect someone's feeding or eating abilities, that someone can be diagnosed with. So they would go to a doctor, a psychiatrist or something, and be diagnosed kind of with one of these things. So binge eating disorder involves binge eating episodes. Bulimia nervosa involves binge eating and then compensating for that in some way, vomiting or exercise or something similar. Anorexia nervosa, which involves restriction. Avoidant restrictive food intake disorder, which also involves restriction. But that restriction is not aligned with body image issues at all. It can also kind of just look like extreme picky eating. OSFED, which is other specified feeding and eating disorders. So that's eating disorders that are diagnosed but don't fit neatly into one of the other categories. PICA, which is categorized by eating non-food items, or items of no nutritional value. So that can look like ice or paper or clay, and not for like tradition or religious purposes, as eating some of those pieces can be common in different cultures and pieces, but outside of that. And then rumination disorder, which is characterized by undigested food being brought back up. So these are some of the diagnoses. I brushed over them really quickly because diagnoses are really just the tip of the iceberg. They are really, really serious. It's important that we kind of know them and talk about them, but there is so much more that kind of lies underneath these diagnoses. And so when we are explaining eating disorders, we really want to think about them on a continuum. We talk about eating disorders occurring on a spectrum, and we are all somewhere along the spectrum. So on this one side, we have wellness. Mostly feeling positive about your body shape or size, or feeling completely neutral about your body shape and size is also okay. You do not have to love it all the time, but you can feel neutral towards it. There's no good or bad foods. You eat kind of like what you want, you don't feel guilty for it, you eat the foods you enjoy, there's balance, all of those kinds of things, and you're able to exercise moderately, again, when you feel like, or when you want to, or when you know it's good for your body to move, or those kinds of pieces. And then we move to preoccupation and disordered eating symptoms. And so these kinds of pieces live in the middle. And so don't necessarily go all the way over to eating disorder. I kind of imagine like a gate right here, and that the diagnosis really gatekeeps the end of that spectrum. But people in both of these middle sections can be seriously struggling and need support, and be in danger as a result of their physical or mental health, even without a diagnosis. So it's really important that we recognize eating disorders and disordered eating symptoms for what they are, even without a diagnosis. So many of the components that we see under preoccupation with food or body and disordered eating symptoms are really normalized in our culture, and we'll get into that a bit, but looking the way that your body's consistently wanting to lose a few pounds, constantly or frequently kind of thinking about food or eating or your body, feeling guilty or bad for what you've eaten, and then disordered eating symptoms, which is the restriction, the purging, the eating for comfort as like your go-to tool, and working hard to try to kind of like change your body in any way, shape, or form. So it's not a super black and white, you either have an eating disorder or you don't. There's lots of people who live kind of in these middle sections that we really need to be aware of and we need to take care of. And because so many of these middle sections are super normalized and celebrated in our day-to-day lives, it's really, really important that we are looking out for our loved ones that don't necessarily have an official diagnosis, but that doesn't mean that they're not severely struggling and that we don't need to be taking care of them. So thinking about eating disorders on this spectrum and knowing that not everyone is going to be able to get a diagnosis, but we still really need to be looking out for them is a really, really important part of what we're going to be talking about today. These are some of the disordered eating behaviors that many of you kind of listed already. This is, of course, a non-exhaustive list, but some of the more common ones that we might see in someone who's experiencing disordered eating. So the term disordered eating is a descriptive phrase. It's not a diagnosis within itself. Those other pieces were the diagnosis, but individuals with disordered eating individuals with eating disorders exhibit disordered eating, but not all disordered eaters have a diagnosis. So it's kind of like a nuanced piece. And so important to recognize some of these pieces. So restriction in eating. Eating disorders are not diets, but diets are a big risk factor for eating disorders and disordered eating. Fasting, again, not for religious or cultural reasons. So of course, like Ramadan is coming up. That in itself is not a disordered eating behavior. Eating past the point of fullness or eating out of control when eating. Excessive exercise. So even when it's miserable out or when someone is hurt or sick, they still kind of like feel the compulsion to exercise. Laxatives, diet pill use, all of those kinds of pieces. And an important one that we do want to note is the misuse of insulin to impact appetite. There isn't an official diagnosis for this, but it's kind of known generally as diabulimia. So someone impacting their insulin so that they don't feel as hungry, so that they can go longer without eating, et cetera, et cetera. Really quickly, some of the warning signs. So I invite you to read through these as you're able, and we'll kind of touch on a few. So behavioral, dieting behaviors, obviously, again, eating disorders are not diets, but dieting is a big risk factor. So if someone is dieting, just being aware of that, of if it's going from, a general kind of diet. I mean, I don't like diets in general, but to something that's, there is no gray. It's either good or bad, right or wrong. If they eat something that's not in their diet, they are a bad person for it. When they get into that kind of thinking, the rigid black and white thinking that we kind of see in the psychological side, that's when it is definitely a warning sign that something deeper is going on. Excessive or obsessive exercise or eating or feeding habits, behaviors that are focused on body shape or weight, all of those kinds of pieces. To the extreme where it's impacting their life or impacting their mood, or any of those pieces. Physical fluctuations in weight. Some may exhibit multiple signs or symptoms, and that's great. weight gain or loss may or may not occur or may not be observable. It's up here. It's definitely a warning sign, but not everyone with a severe, potentially life-threatening eating disorder is going to change their weight. Some people will actually stay at what might be deemed a healthy weight, but can still be very severely struggling and be in potential physical danger. So important not just to focus on the weight, but also some of the other issues. So are they, sleeping okay? How is their like heart rate? Are they having like dental issues? Are they dizzy or fainting? Or those kinds of pieces are other physical warning signs we want to be aware of. And then psychological, so preoccupation with food or body shape or weight, anxiety around eating or meals, depression, anxiety, irritability. I cannot tell you how irritable I was when I was struggling with an eating disorder. I was also 16, so that might have played a part, but it's very complex. Someone can have multiple of these, none of these, but these are just some of the more common ones that we might see. Really quickly want to touch on what causes eating disorders, especially if there are any parents in the crowd. Really important. I know like self-blame can kind of be a big part of that, but really, really important to recognize that people do not cause eating disorders. Eating disorders are caused by a really complex combination of several different factors that can increase someone's likelihood that they're going to be experiencing an eating disorder at some point in their lives. We don't fully understand the causes, and there's lots of research still being done that we are continuing to kind of like research and learn about in those kind of pieces. But there's biological elements, so genetics, neurochemistry, medications, all of those kinds of things. They play a big role. There's evidence to suggest that eating disorders have a genetic basis, not necessarily like inheriting one gene, but like a more complicated interaction of genetics. Psychological factors, so behaviors, personality characteristics can place a person at a greater risk for adopting disordered eating habits or behaviors. And then sociocultural factors, so social media, messages from families or peers, even if they are well-meaning, experiencing discrimination or oppression. So we know that people of color, Black, Indigenous, 2S, LGBTQIA+ individuals, all of those people in marginalized identities have an increased risk of struggling from disordered eating because of the discrimination and oppression that they face on a day-to-day basis. So important to kind of recognize those pieces too. The one thing that we often kind of say is genetics loads the gun and like psychology or environment pulls the trigger. So it's a lot of different pieces. No one thing causes an eating disorder, and it's not a super cut and dry process in terms of developing eating disorder. There's lots of different things that are playing at once, and so it's important to recognize that obviously then one simple thing is not going to fix an eating disorder or make someone recover from an eating disorder either. So that was a brief overview of eating disorders. I want to dive a little bit, dip our toes into talking about diet culture. So an important part of understanding how to talk to people about eating disorders and disordered eating is understanding how these behaviors fit into the more general social landscape of what we call diet culture. So understanding what diet culture is, how it works, and how we participate in it and perpetuate it is good to know, so that we can work to kind of dismantle the certain ways that we think about food and our relationship to our bodies, so that we can better help and support others. So when we think about on the spectrum, those two middle sections of preoccupation and disordered eating symptoms, it's diet culture that normalizes those pieces, that makes actually being happy or okay with your body seem absurd, and that normalizes always wanting to change something about your body or not being happy with it. And so that's why it's really, really important that we are able to kind of like stop and look at and acknowledge diet culture in how it shows up. So this is a definition by Christy Harrison, who's an incredible anti-diet dietitian and certified intuitive eating counselor. So she explains diet culture as a system of beliefs, and there's kind of a few different pillars. So it's a system of beliefs that equates thinness with health, and kind of creates this black and white mentality of if you are thin, you are obviously healthy. If you are not thin, you are obviously unhealthy, when that is completely not true. There's so much nuance to health and what that looks like. I can assure you that I am healthier now. I think I'm technically overweight, but healthier now than I was even when I was at a healthy weight and struggling with an eating disorder. So it's a really, really complex thing when we're talking about health that diet culture really tries to make into just thin or not thin. It's a system of beliefs that promotes weight loss as a form of achieving status. So we congratulate weight loss, we celebrate it. It's something we are kind of like taught to aspire towards always. And that is a way that we can kind of like gain status amongst the people around us and within and for ourselves. It's a system of beliefs that values certain ways of eating over others. So following certain diets or eating specific foods, we have foods that are labeled superfoods or those kinds of pieces that all kind of like play a role in how we value eating. And it's also a system of beliefs that devalues bodies that do not fit the image of health. So if a body is not fit or thin or whatever kind of is that image of health, the body that doesn't fit that is kind of like seen as less valuable in some way, shape, or form. So diet culture is like a broad landscape that we live in, and we might not even be aware of it in a lot of ways. It kind of takes putting on, your critical diet culture thinking glasses and like looking at the world around you and kind of like taking it step by step. It does not just affect those that are on diets or interested in weight loss. You do not have to be participating in dieting to be participating in the culture of dieting. So moving away from these ideals is hard because we're surrounded by it. It's normalized. A lot of us, or a lot of people, have been on diets since they were young. It's been a part of their lives. People have invested a lot of time and money and energy into diet culture and into the belief that, if they lose weight or whatever, they will be the happier, healthier version of themselves. When in reality, you could be a perfectly happy and healthy version of yourself right now in the body that you have. And so it's really, really complex to try to stop and get away from that, but important for us to try to recognize when we're thinking about eating disorders and how we can support the people around us. So diet culture shows up in a lot of different ways when we congratulate or celebrate weight loss, if we use fitness as a form of punishment for ourselves, so saying you have to like burn off those calories or we'll walk off that cookie later or whatever. Losing weight offered as a blanket recommendation in healthcare. Losing weight does not fix all health problems, not by a long shot. Assigning moral value to food, so this food is good or this food is bad, that's not real. There's food that might be more nutritiously valuable. There's food that might not have as much nutritional value, but that doesn't mean that they are good or bad. It just means that they have different nutritional content. And that's something that you can be aware of and know for yourself. But doesn't mean that the foods hold any kind of moral superiority. Guilt-free food advertisements, this always gets me because guilt is not an ingredient that you can sprinkle in or not sprinkle in and then it's guilt-free. All food is guilt-free if you choose to not feel guilty about eating it. The assumption that all people want to lose weight, equating larger bodies with laziness. There are a lot of people who are in larger bodies than me that are a lot more fit than me. I can lift things I could never lift. I can run farther than I can run. But that's a nuance that diet culture doesn't really allow for. And then weight as a primary indicator of health rather than the health of our relationships or our energy levels or how we feel about ourselves. Weight is kind of like the one thing that we look at and we look to. I'm really quickly going to share a video that kind of helps to explain this a little bit better in some ways. And so this is called Poodle Science, and it's by the Association for Size Diversity in Health.
There's a big problem at the center of our research on weight and health. What's the problem? Well, picture a society made up of dogs. Let's say poodles are the bossiest group. They're the ones you see down at the doggy park barking at all the other dogs about how to live their lives in order to be healthy. But the problem is, Poodles think that every other kind of dog is just a really big, a really small, or a really fat poodle, when actually the other dogs aren't even poodles at all. They're terriers, or mastiffs, or greyhounds, or labs. And all of the thousands of different dog breeds have different lifespans and different health risks. Each one has evolved to use food differently for different specialties at surviving. Some for staying warm, some for running fast, and some for being strong. They're meant to be different sizes and weights. So the poodles think the mastiff should lose weight, but a starving mastiff never becomes a poodle. The poodles don't understand that dogs come in many more sizes than they can imagine in their poodle-centric ways. So this becomes a problem when it comes to poodle science. When the poodles did their weight and health research and made their claim that lighter dogs are healthier and live longer, they weren't comparing thinner poodles and fatter poodles. They were comparing poodles and mastiffs. So the recommendation for mastiffs to lose weight is based on the false assumption that if all dogs reach poodle weight, then all dogs will have poodle health. But once again, a starved mastiff just isn't a poodle. This poodle science doesn't even test whether a starved mastiff lives longer than a mastiff who has enough to eat, because one would have to compare mastiffs who maintain poodle weight to mastiffs that maintain mastiff weight. And it turns out that starving mastiffs regain weight, which after all is a much better thing than starving. But the poodles can only see that regain as a failure of mastiff self-discipline. Look, poodles are great, but poodle-centric health policy is a nightmare. Good science tells us that it's better to recognize and respect the ways we're different, because how we're treated, having good friends, having access to decent food, a place to play, restful sleep, and medical care make a huge difference in our health and longevity, for all of us, whatever our size.
So that's a video that hopefully just kind of shows and shares some of the complexity and nuance when we're thinking about ideas of health, about what health looks like, feels like, or sounds like in our lives. So, of course, understanding diet culture is an important part of understanding eating disorders, not because eating disorders are diets, but because we know that eating disorders are both developed and recovered from by people who exist kind of in this wider landscape of diet culture. So your loved one or yourself who is struggling exists in this society, in this culture that celebrates weight loss, that demonizes eating certain kinds of foods and all those kinds of pieces. So it's really important that we recognize that. And if we can recognize ourselves within that, to try to help create an environment that is as safe and secure as possible for our loved ones or the people that we are supporting who are struggling. So we all live in this larger landscape of diet culture, and not all of us struggle with eating disorders, but people who are struggling do live within this culture. So even if the cause of someone's eating disorder has nothing to do with, social media or sociocultural components, the space in which they're working to recover is still within diet culture. So it's really important that we recognize that they may be being praised for the eating disorder, they may be encouraged by other people to engage in disordered eating, and all of those pieces. So knowing this becomes really important for those of us who are responding to people with eating disorders to know that in addition to the eating disorder, they are also fighting against these broader kind of societal messages in this context. And so hopefully that kind of helps set the scene a little bit in terms of in the ways that we need to be thinking about not just the person, but the landscape in which we are trying to help support them through recovery. Now we are getting into supporting someone with an eating disorder, and very shortly I will be able to stop talking and you can hear from someone else. But first, in terms of supporting someone with an eating disorder, there are two kind of models that we think are really, really important just to help build understanding of an eating disorder and of eating disorders and what it looks like or what it means. So I have two models I want to kind of share and go through fairly quickly. So The first part of supporting someone with an eating disorder is building an understanding. And this, not really model, this list of things kind of goes through some of the functions that disordered eating behaviors serve. So a lot of the time, eating disorder behaviors are serving a functional purpose for the person who is struggling with them. That person may not be aware of that or conscious of that, and it may not be clear to anyone, even the person struggling. But it's important to recognize that disordered eating behaviors don't come out of nowhere. They're serving a purpose most of the time, not all of the time. Sometimes, they exist for different reasons, but a lot of the time someone's struggling, that disordered eating is serving a function for that person. And so when we can take a step back from the disordered eating and take a step back and kind of look at what is the purpose, why is this happening, or what is the function of what they are experiencing, it can help us to kind of reconceptualize a little bit, hopefully offer them a little bit more grace, a little bit more patience, and really recognize the importance of getting to that kind of like deeper meaning of the disordered eating. So they are serving a purpose. The behaviors are like coping or survival tools that someone is using. And once that person understands the function of that behavior, it's easy for them to bring in less destructive other kinds of coping or survival tools. So disordered eating might be serving a self-soothing purpose. So I think someone mentioned at the beginning, emotional eating. I think it is important to note that emotional eating is not always bad. All of us may eat emotionally from time to time, and that is not necessarily a bad thing, right? Food is not just fuel. Food is culture and community and tradition, and baking muffins with your mom and making your favorite meal with your grandma, and teaching your kids some of your favorite like cultural dishes or those kinds of things. Food is really, really meaningful and beautiful, and we don't want to take that away. And so if you have a long hard week and you have some Ben and Jerry's or have a glass of wine, that's not automatically a bad thing, right? Food is a part of our day-to-day lives. And so it's okay to be engaging in those ways. But if, food or eating is the only kind of go-to tool that someone is using to soothe themselves, that's when it becomes a problem. When it is their only tool, when it's impacting other parts of their lives, when, it's impacting their relationship with themselves, those kinds of pieces, that's when it's really, really important to take note. So I do want to mention that caveat. Avoidance of sexuality or memories and feelings, especially for folks in the 2S LGBTQIA+ community. Avoidance of sexuality is a big one that very well can come up, and that's important to note. Trying to cope with negative emotions, whether that's through restriction or eating or other kinds of disordered eating behaviors, it can show up in many different ways. Maintaining control is one that we hear quite a bit of. Things feel out of control to a person, and the one thing that they maybe can't control is their eating, and so that becomes kind of the function or the purpose of that disordered eating behavior. So these are, of course, again, not an exhaustive list, but just to get you thinking a little bit about, there is a purpose, there is a function that this is serving. Maybe you never know what that function is, and maybe the person struggling never, comes out and tells you what the purpose of it was, but it's just good for you to know, to be able to kind of like reconceptualize a little bit, maybe offer them support in helping them to try to like dig underneath a little bit and get out what the function of their disordered eating is serving. The one other model that is really, I think, important in helping us to build understanding for loved ones who are struggling is what we call the restrict binge cycle. So often as someone is struggling with binge eating, it's not like a one-time thing. People kind of fall into this cycle, and it's very, very hard to get out of once we are in this cycle. And I think it's, once you notice it, you're very kind of able to see it, and maybe have even like seen yourself in this space. So, we start with, I need to gain control. So, I want to lose weight, I need to gain control, or someone doesn't have access to food, so they participate in dieting or restricting or purging, whatever that looks like. Our feelings of hunger, our cravings, all rise. That is a normal biological response to restriction. Our body doesn't know that we are restricting by choice. Our body is like, I am hungry. We are in like famine mode. So I am going to increase cravings and increase hunger so that the brain knows that when food is accessible, that we need some food. We need some nutrients up in here. So it's a normal biological response when, we feel that hunger or we feel those cravings, especially if we are restricting something specific. If we're not allowing ourselves a certain type of food, we are going to crave that food more, a normal biological response. And so that then leads to binging or overeating or feeling out of control, eating a lot of that food you said you weren't going to eat, or eating past the point of fullness, or those kinds of pieces. And then we fall into the guilt and the shame of, I can't believe I ate that much. I can't believe I did that. I'm embarrassed, or I feel shame, or I feel guilt. And then I need to gain control. And we start the cycle all over again, or they start the cycle all over again. And so once you kind of see it and know it, it's a little bit easier to recognize, but just knowing that, this is a natural response for us biologically, and then in response to kind of the society that we live in. So there's a lot of different factors that kind of keep us on this cycle and keep the cycle moving time and time again. I am going to pass the mic over to Karen to talk a little bit more about what it looks like to offer support to our loved ones and to people who are struggling.
Thanks so much, Erin. And, it's so true that for caregivers or parents, it's so important to learn ways of offering support that are really helpful. So as Erin mentioned, my daughter Sonia had a very severe eating disorder for a number of years. And I think as a parent and caregiver, I think I must have made every mistake in the book as far as caregiving. And I think partly it's because as parents, we get so worried about our kids with eating disorders that we just want to get them to eat. But of course, that can then lead on to a lot of conflict and misunderstanding. So thinking about if you have a loved one, whether a child or a friend or a spouse who is struggling with an eating, you are really concerned about them. You've observed behaviors, you're really worried, and you want to do something for them. Think about how you're going to bring up the topic. Try to make sure that you're in a comfortable space where you're both feeling relaxed and not tense. And think about, again, what are the points you want to bring up? Really important to use I statements. So instead of saying, you're not eating enough, or you're skipping meals, you're doing this, you're doing that, just say, I've noticed that you quite often don't eat with us. And I'm wondering if you could tell me a bit more about that. So using I statements and also open-ended questions, trying to avoid language that could be triggering. And also really important to avoid jumping to simple conclusions or simple solutions, because that can just lead on to a tremendous amount of conflict. Next slide. So when I'm talking about the I statements, you could say something like, I'm noticing that you're not yourself, or you're having mood swings. I can sense that something's bothering you. Is there anything you want to share with me? And then always reinforcing, know that I'm here for you, always. I love you no matter what you're going through. And this is something so important, because when you can get caught in the cycle of fear about your loved one, it often can quickly turn to anger as well. And you can start offering solutions or getting upset with them. So this second part is so important. Know that I'm here for you always, and I love you no matter what you're going through. Really important. People can add things to the chat as well as we're going along, thinking about, how these approaches would be positive. Here's another ideas about what you might say. Maybe this is regarding a friend. Hey, I'm a bit worried about you. You aren't doing fun things very much anymore, and you aren't eating or enjoying the foods you used to like. So quite often you'll notice that somebody, perhaps a friend, is continually refusing to go out for a meal with you, or to do the things you used to do. They may just be looking worried, they may be dropping activities that they used to do. So all of these behaviors can be clues that something is going on. And don't jump to conclusions, just starting with that really open-ended I statement. I'm a bit worried about you. And then if the conversation is going quite well, you could say, I'm thinking maybe we should make a doctor's appointment. Don't push that right away. If the person's resistant, then back off a little bit. And again, really express your support for the person, your love for the person, and then you can bring it up again a little bit later. But try your best not to fall into conflict situations, because when you fall into conflict, it really doesn't help. And the person with the eating disorder can start feeling a sense of rejection. It can aggravate their own sense of shame and guilt, because people with eating disorders often feel tremendous amount of embarrassment about it, shame about it. They feel like, why is this happening? I shouldn't be doing this to myself or my family. But they're caught in this cycle. And as Erin was saying, there are many reasons, underlying reasons why the eating disorder is there and what purpose it's serving, which you don't really know about, and which the person themselves might not even be aware about. So some really important things just to remember. And just add to the chat if anything of this is really resonating with you. Here's another thing you might say. I'm concerned about your relationship with your body and how it's affecting you. Do you want to talk about it at all? So again, offering that opening statement about, do you want to talk about it? And even if the person doesn't want to talk about it at that time, you've left the door open and you've expressed your concern. So this is a great way of starting to build that relationship. Okay, next slide. And Erin, if you can keep an eye on the chat as well, if anybody adds something. Really important, this whole thing about being a dependable listener. So practicing active listening. So this is where you're really observing the person that you're speaking to. Look out for body image, body language issues. Are they leaning back and have their arms folded? They don't want to listen to you. Or are they actually maintaining eye contact? Try to keep your voice really soothing and calm. Asking questions. You can summarize what they've said to make sure you're understanding. Contributing some questions or reflections, but really getting the person themselves to bring up the points that they want to bring up. And then this holding space is also just super important. So you want to validate their emotions. So there's a really important distinction between validating a fact and an emotion. So suppose the person says, well, I'm afraid of gaining weight. I don't want to be fat. So then, you could say, but you're not fat. You're perfectly fine just the way you are. Well, that can just lead on to conflict. But instead, if you validate the emotion by saying, I can see that you're feeling really worried about changes in your body, or I'm sensing that you're feeling anxious about gaining weight. That's validating the emotion, not the fact. And then again, reinforcing your unconditional support for that person. Trying to withhold judgment as much as you can. And it's difficult to do this sometimes, because when you're observing a behavior that might be actually quite dangerous for the person, it's really tempting to get judgmental and say something like, if you keep purging like this, you're going to end up in hospital, or you're going to end up dead, or something like that. I mean, these may be very true, and these are the fears that you're experiencing, but withhold that judgment and try to work with the person. Also examining the role that you're playing, because you may be aggravating the conflict between you, and that just doesn't help. Okay, next slide. So keeping the focus on them and keeping the questions open-ended, as I'd mentioned. Have you been able to check in with yourself at all the past few days? Or just saying, how are you? What do you need right now? This is a really good question. You know, asking the person, what do you need? Try to avoid that pressure to fix them. And also definitely try to avoid saying, I know how you feel, because if you haven't had an eating disorder, there is no way that you know how they feel. Having an eating disorder is a really devastating experience. And so don't go there if you don't say that you know how you feel if you really don't. Then you can say, I've noticed that you seem tired lately, or I've noticed that you have stopped doing things you used to enjoy. How are you feeling? So make an observation about a behavior and then ask an open-ended question about the emotion. And then I know the last time we talked a bit about eating and food. Is there anything in that realm that you want to talk about? So again, reintroducing the topic of eating and food, but in a very gentle way, just keeping them really in your heart and open. Someone would say in the chat, somebody's saying, I'm here for you as a check-in. That's beautiful. Just a simple statement is so important. You know, and if you just say something like that, then the person knows that, you know, you're open to listening. And in the chat, we're just saying, what else could you say to check in about someone's mental health? Anyone else have any reflections or comments of what you might be able to say to check in about someone's disordered eating or mental health? Just add it to the chat. Great. Okay. I like this one. I love you. You're special. You're needed. Those simple statements are just so important. It also helps to remind people of who they are and who they were, because sometimes people are struggling with an identity issue. Somebody else is saying, just making time to spend together. I love that. You know, with my daughter, when she was really sick, occasionally we'd be able to just go and do something fun together, like going to a movie or something, and not talk about food, weight, or body image at all. Lauren's saying, what do you need from me? I really like that one. And when I was thinking back to my daughter, it would have really helped me if I'd said, tell me what you need me to do, or how can I help, as Charlene is saying. Great example. And if she could have told me some specific things I could have done, that would have been really helpful, because of course the parent is really wanting to help, but they don't know what to do. And so often they end up saying the wrong thing or doing the wrong thing. So I really like these suggestions. What do you need from me? How can I help? Great suggestions. Next slide. And I'm just finishing off this part by talking about medical emergencies. So being a doctor, these are some of the things I used to worry about. And, you know, it's certainly true that eating disorders are physical as well as psychological illnesses, and they can be very, very dangerous. They're also mental illnesses, so people with eating disorders can become very depressed or suicidal. So if you notice that your loved one is literally becoming disoriented or confused, this is a really dangerous thing. If they're vomiting frequently in the day, this can lead to very dangerous electrolyte imbalances. Muscle spasms can also be a sign of a potassium imbalance. Of course, chest pain, trouble breathing, fainting spells, extreme weakness, any of these things are really dangerous. Blood in the bowel movements, irregular heartbeat, or low heartbeat. So people can take their own pulse. If the pulse is below 50, that's a warning sign. Cold and clammy skin. All of these are reasons why you should take your loved one to the family doctor or to the emergency department, depending on how bad they are. I'm noticing in the chat that Karen is saying, I'm noticing you're feeling agitated and irritated. I'm noticing you're not eating lunch at work. Males also struggle. Yeah, good point, Karen. And for males, often eating disorders turn up in slightly different ways. They're often trying to develop more muscles and become buff and lean. So really important to recognize that men do struggle with eating disorders as well. So those are a little bit about the medical emergencies, and that's about it for my section. Back to you, Erin.
Thanks so much, Karen. Sue put it in the chat. I know we are nearing the end of the hour, so if people have to drop off, that is completely okay. If you can fill out the survey, it is super, super helpful to us. We are super happy to be offering this session completely free and make it accessible. So if you are able to fill the survey, it is one way that you can really, really help us out and make sure that we are offering supports that are meeting your needs. And if you have ideas for other things we could be talking about, or if we did a part 2, what you'd like to see, please include that in the survey. It really does help us. I'm going to talk really briefly now just about accessing resources. So again, this is a little more specific to us kind of like geographically in Ontario, but some of the elements of how we think about accessing resources can be true for anywhere. So hopefully this kind of helps. So when we talk about accessing support, we at Body Brave think in terms of stepped care, and stepped care is like not something that we created at all, but it's a evidence-based kind of like stage system that involves a series of mental health interventions. And it's basically a fancy way of saying that there's a lot of different options for treatment and support that vary in different ways. So based on each person's capacity and their needs, the intention of stepped care is that each person starts on the step that would be most effective but least intensive for them. So depending on what they are experiencing, are they medically stable, all of those kinds of pieces, that will affect which step they might be on, which will be the most effective form of treatment or support, but the least intensive, the least, aggravating their lifestyle or their current routine or those kinds of pieces. So program intensity can then be stepped up or stepped down depending on the person's need and how they change. So maybe, at one point, someone, the most effective but least intensive treatment would be, day hospital treatment, kind of up near the top. But as they're getting better, maybe they take a few steps down, or maybe they actually need additional support, so they take a step up. And so this is kind of how we think about stepped care. The exact steps in stepped care change a lot. I'd love if there were agreed upon steps across all organizations and those kinds of pieces, but these are kind of the ways that we conceptualize the steps of eating disorder support and care. So one resource that is accessible to you is Body Brave. We kind of work on like the steps 2, 3, 4, 5, kind of in that realm. And so we offer self-guided support. So, you don't ever have to necessarily even like meet with anyone specifically or do any one-on-one pieces, but people can kind of be learning some skills, some different opportunities in terms of thinking about eating disorder recovery and those kinds of pieces. We have group treatment, so 10-week groups that are focused on different aspects of recovery. So, we have some for people who are struggling with binge eating or restriction, people who need a little bit more help in thinking about nutrition, people who have been in recovery for a number of years and kind of just need some help with maintenance, all of those kinds of things. And then we have one-on-one treatments that are available as needed. Medical assessments, individual psychotherapy, short-term psychotherapy, and then self-guided help with a healthcare provider. And so that's what Body Brave kind of offers. But we've also included the next couple of slides are I'm kind of breaking down each of those 8 steps that was on that stepped care slide into what is available for people in Ontario. So this is a list, and these are linked if you get the kind of PDF of the slides, which you can email me, Christina, if you can put my email back in the chat, if you do want access to these slides. So, there's lots kind of across Ontario. There's some specific for different identities. So for gender diverse or Black, Indigenous, people of color, different opportunities for people to get kind of community-based programming that is accessible to them. There's community-based individual programming, a list of hospital-based outpatient programming, intensive outpatient programming, day hospital, residential programming, and then that last one should be intensive inpatient. And so there's lots of different options in terms of what kind of support someone might need. It's hard to know where to start. We are kind of in the midst of creating resources to help people really gain an understanding of where they can be starting. And if you go to the Body Brave website, you can learn a little bit more about that. But yeah, just know that, accessing resources, if you don't know where else to start, shoot us an email at Body Brave and we will try to help you in all the ways you can. Resources like CMHA, Hamilton, can also help get you connected with different resources and different pieces that that you can really benefit from. Additionally, in the slideshow, I have a slide of resources for caregivers. So again, a little more specific to Ontario, but this is a list of currently existing support groups for caregivers, friends, partners, parents, whatever that looks like. So Eating Disorder Parent Support Group Canada is kind of overseen by Danielle's Place in a way. You can join the Facebook group. Again, it's linked if you want the slides. And so they have a number of different groups that you just kind of like drop in and attend. There's other ones like one-off sessions on things like meal support. There's ongoing sessions that take place, every week, all of those kinds of things. So different opportunities for you to try to get involved if you are wanting kind of more additional support for yourself in your caregiver role, because it can be really, really hard. And these are some kind of upcoming education or training events. So I tried to put them in order of when they're coming up, but the Feast, which is families affected, it's families, it's for like parents and caregivers. I cannot think of the acronym right now, but they have a conference happening in a couple of days that talks about, the role of the caregiver. My kid has an eating disorder, now what? From Eating Disorders Nova Scotia, a session on navigating diet and exercise culture, lots of kind of different opportunities for you to kind of just continue to develop your knowledge. And then in the rest of the slides are additional Body Brave resources, references, all of those kinds of pieces. And I think that's everything. There might be some questions in the chat. Oh, but Christina and Karen are answering as well as they can. Yeah, Body Brave is completely virtual. We're staying virtual. Our treatment is only available for people in Ontario. That's just based on like insurance and what we are actually able to do. Our support programming is available to kind of anyone in Canada, and then sessions can be attended live by anyone. But always feel free to reach out to Body Brave if you have any additional questions about any of those pieces. Again, if you want access to the slides, please don't be afraid to shoot me an email. I will just be replying to emails all day and making sure that people have access to these slides if you do need them. I see we've gone a little bit over. I'm so sorry, Sue. I don't know if you have any last comments or ending notes at all.
Just a very, very big thank you. This was absolutely amazing. And I really hope that people got as much out of this as I did today. And thank you everyone for joining us. We had a really great turnout. I think we maxed out at about 95 participants. So that's wonderful. And just again, thank you to everyone.